The Nigerian Cancer Society (NCS) has expressed deep concern over the meagre allocation of 150 million naira for cancer treatment in the 2025 budget, describing it as grossly inadequate to address the country's cancer burden. During a seminar in Abuja, organized in partnership with Pathfinder International, Professor Abidemi Omonisi, President and CEO of the NCS, stressed that cancer funding has not been prioritized despite its devastating impact on patients. The society urged the National Assembly to review the budget and allocate sufficient resources to mitigate cancer-related deaths and improve treatment access. Highlighting the government's Cancer Health Fund initiative, Professor Omonisi called on private sector donors to enhance funding and sustain progress in cancer care.
To stabilize some patient, you need average of 20 million. If a patient has breast cancer, you diagnose, you treat. To stabilize that patient, to give a little hope that that patient will survive, that patient will have minimum of 20 million. And now Nigeria is budgeting 150 million only to support prostate, to support cervical, and to support, cervical and breast. That is even nothing. It's better for the federal government to say this year we're not even supporting cancer patients. And we know that they are not willing to support. We must, do everything possible within their power to increase, that amount being, allocated to cancer health fund. Otherwise, you are telling a cancer survivor to go and die, this year. How many patients can afford 20 million in Nigeria? How many? 20 million. We are so passionate, about this because a past president of the Nigerian Cancer Society, he was a professor. He sold his car, sold his house. We contributed money to save his life and died 2 years ago of liver cancer.
Meanwhile, Dr. Adamu Umar, the immediate past president of NCS, emphasized the need for consistent vaccine availability alongside awareness campaigns, warning that public trust is eroded when vaccines are unavailable despite promotional efforts. He called for strategic partnership to tackle production and distribution challenges.
HPV vaccine is already routinized now into the immunization, routine immunization schedule for Nigeria. Only that we still have issues regarding vaccine availability. In this situation whereby there will be consistency in what we do.
Adding his voice, Dr. Uzoma Ugochukwu, an NCS consultant, stressed the media's critical role in debunking myths about the human papillomavirus vaccine, urging media outlets to champion accurate information and increase vaccine uptake.
The support of the media is really very key to address myths and misconception about the human papillomavirus vaccine across the society. We've had few incidences of misconception, myths, and lack of understanding as regards the vaccine. So it's important for us.
Funded by Pathfinder International in collaboration with the Nigerian Cancer Society, the second phase of the Enhancing HPV Vaccine Awareness and Uptake project is seeking stakeholders' outreach initiatives to counter misconception and advocate for improved healthcare policies. The NCS reiterated its call for stronger public-private partnership to secure better outcomes for Nigeria's cancer patients. Vincent Okushi, KTV News.